Um, yes, actually, this problem of dealing with the healthcare of senior citizens, this problem is not only restricted to our country. Across the globe, we are now seeing that people living above the age of 60 constitute a significant percentage of the population. In fact, there is data to say that by the year 2050, with respect to people living above the age of 60, there is a prediction that there is a more than 300% increase in their population. So even it is predicted that in 2000, the percentage of these people who was roughly say around um, it will be around say 76 million, this is going to increase to 324 million. And there is also data to say that in the people who are in their 60s, 70s, and 80s, more than 25% of them suffer from diabetes. And then there is the menace of pre-diabetes. And these numbers are just with those people who are diagnosed, who have good access to healthcare. Now, there may be so many people who don't have access to healthcare or who are financially challenged that they cannot access healthcare. So this is the burden of the problem. And from the way we have handled the pandemic, the kind of challenges this pandemic has, thrown to us, we have always realized that preparedness is the key. Now, treatment in elderly people actually it has got its own challenges. Like the the patients themselves may be having a lot of disabilities, whether it may be physical, it may be financial, it may be mental challenges. In addition to that, in our country, we have this big urban and rural divide. So the key to approaching this problem is empowering healthcare providers at different levels of healthcare, right from the primary healthcare level to the uppermost level of healthcare. We need to identify the problems of the elderly people as a separate set of problems, and we have to empower the treating physicians with the guidelines and the training that is required to handle these kind of people. Also, unlike in other scenarios, in elderly people, diabetes doesn't present as a single entity. Now we need to realize that an elderly person generally will be suffering from some other chronic illness also. So it's generally a combination of these things which presents. So co-managing these kind of diseases, then these people are on many drugs which generally we refer to as polypharmacy. So some drugs may interfere with the way the medicines for diabetes act, or there may be drug-drug interactions. So knowledge is the key. Empowering the patients and empowering the healthcare providers with this kind of a thing is the key to handle this problem in the elderly.